Hello and welcome back. My name is Ken Vitale. I'm a physician working in orthopedics. I also teach anatomy and physiology at the university here. And in this series, I expand upon some concepts that we go over in lecture and introduce some extra learning tips and tricks and mnemonics and hopefully some fun. I've also been experimenting with some AI generated images, combining some art themes and medicine lately, since I'm kind of into that. This above here is, well, obviously the vascular system, but combined with a little bit of expressionism and pop art this time. I think it was kind of fun. All right, let's get started. I also do tend to let some philosophy trickle in and creep into my videos. And if you've ever heard of this analogy, how life is like an onion, well, it ties into histology, believe it or not. So here we go, right into histology. We have three layers in terms of the layers and blood vessels. And I know this is a little weird mnemonic, but hey, it works, right? I eat smooth onions. Intima involves endothelium, the inner cell layer. Media is the smooth muscle that has control of the tone and pressure of the blood vessels. And the externa is the outer layer of connective tissue anchoring things in. The elastic fibers are in like the aorta and all the proximal vessels there. So yeah, I hope smooth onions helps you recall possibly this mnemonic, but it works. I liked it. I use it a lot. Related to this, that's the histology mnemonic in terms of the function of the each layer here. Intelligent minds expand, or excellent minds expand. I like that one better than intelligent for intima, but well, whatever works for you. I think endothelial cells is the key thing to remember. Media for the muscle, and then external protection. So intelligent minds expand profusely. And yeah, I would like my mind to expand profusely as well. And if you think of the vascular system, perhaps it will. And that brings us to our last mnemonic, endothelial cell function. There are about 7 key roles. There's actually a ton of things that endothelial cells do. We are going to summarize the top ones. First one is a barrier, right? Is in direct contact with the blood, and it is the regulator in terms of facilitating flow of nutrients in one direction and waste products in another. It helps regulate the tone in terms of constriction and vasodilation. Nitric oxide is a very well-known molecule released by endothelial cells. Inflammatory response. The endothelial says, hey, we got a problem here in terms of inflammation or an infection. And it releases all those signaling molecules to bring neutrophils over to help fight or infection. Related to that, when endothelial cells have dysfunction, they allow, bad seeds in, like cholesterol and things like that, in terms of allowing plaque to build in our heart when we get coronary artery disease. Rounding this out, we see this a lot in PRP when people do PRP injections. VEGF is a well-known molecule that gets released to help grow new blood vessels. There is some good and some bad, like I was talking about before with the cholesterol and the lipoproteins, your LDL and HDL. There is some function with that in terms of how it allows things to pass. And then the last one, also related to, well, honestly, the above 6 ones, it helps with various different signaling molecules to help regulate just overall homeostasis of your vascular system. So we need a mnemonic for that. And well, B vitamins, B vitamins. You can try to maybe come up with a better one than that, but this is what I got. One, obviously, it's a barrier. We're going in order from those top 7. The second one is vascular tone. Third one is try to remember it. What you're going through, inflammation, infection. Yeah, there we go. The fourth one, unfortunately, this happens when we get a plaque and we get a blood clot in our heart. Angiogenesis is the next one. M for metabolism. It's not quite vitamins. It's more vitamins. Vitamins. I don't know. If you have a better one, please let me know. Send it in the comments. I would love to hear. We are sharing all these mnemonics to help all of our students learn and grow together. So it is usually about this time in the class that I teach where I start to introduce other anatomy reference textbooks and resources. After all, learning anatomy is about the images, the pictures, the vocabulary. It's not like physiology where you're trying to learn and memorize steps and processes. It is all about learning what the thing you're looking at, what does it look like, what's the name for it, spelling it right. This is what anatomy is. Therefore, it is a very visual field to learn, and you need good visuals. You need a good textbook. All the authors out there that have become famous have a slightly different style. Many students want to know, right? What did you use? Which one's the easiest to learn? Or we have some real go-getters out there. I want the best. Give me the best textbook to learn from. But that is very dependent on how you learn, what type of pictures you learn best from. And you have to know the background of the author of that anatomy textbook in order to figure out which one's going to work best for you. These are the common ones that are out there. So I'm going to take a few minutes to review some of these right now because there's been a lot of battles out there, right? Netter versus Sobotta over here, or Rohen versus Netter, or Netter versus Grays. Netter does seem to be involved in a lot of these since he's kind of a core one here, at least in the States. So let's go through some. This is one of the older ones here, Sobotta, a German anatomist, and he was very detailed, the so to speak, if you can say this, German precision, so to speak, type of drawings and illustrations. Really was a landmark textbook that was out there, and he had very nice, clean, precise illustrations. Really laid the groundwork or the base in terms of what all anatomy textbooks should be. So his was very popular. A lot of the older ones, were in German, and some of them are actually in Latin. Sobotta is used a lot in European medical schools. It's pretty much straightforward and works pretty well. So that's a common one. If you happen to be uh, overseas from where I am in America, and you're in Europe, you might come across that. Gray, however, this one is the big one. What a story, too. Henry Gray. Uh, Amazing. At age 31, mind you, he published this, well, masterpiece book. It's a very old one, and I have a picture of one of them coming up. It's basically, imagine like a pencil and paper and these drawings, but he was way ahead of his time when he did it. Unfortunately, in terms of the fun facts that we were talking about with Sobotta before, not so fun fact, he died at age 34 from smallpox, which came from his nephew that he was trying to take care of. What a terrible story. But this book has been pervasive, so to speak, across the whole world. And of course, there's the whole TV series, Grey's Anatomy. There's finally a drawing. This is one of kind of the famous ones that he drew. So that's a little bit of a detour from Sobotta, but what a great story. Then we get Rohen, and this is one that I start to use in the vascular system because it's not like the heart where you can make drawings, you can put in colors, you can kind of sketch out images and basically understand it. The vascular system is kind of harder to draw. And honestly, sometimes the actual picture of the cadaver, even though it's gross, works the best. So Rohen, which was a joint venture by a Japanese person, Chihiro Yokochi, and Johannes Rohen, is basically just a bunch of photos. I don't have a picture of that because we're trying to keep gross photos of, gross anatomy and cadavers out of YouTube here. But it is all about actual pictures, what they look like. Nothing has been retouched or colorized or stylized. Some of the cadaver specimens have been injected with various colors of dye to illustrate, in this case, in the section that we're doing in this lecture, the vascular system, red in the arterial system, and they inject blue in the venous system. But this is what the actual cadavers looks like, a realist approach there. That's Rohen, really cool guy. This is the book, so I'm not going to open it up to show you the pictures. This is the cover, and I gotta say that what is going on here? This guy, shirtless man with kind of the hair slicked back and the kind of model, pose. What I don't know. All right, Rohan, really cool guy, lifelong educator. The whole time he was in academia, lived to 100. How amazing is that? What a cool story. So Rohan is really cool. And then there's Netter. This is the one that I learned from. This is the Michelangelo, so to speak, of medicine. I went to NYU, and Netter was NYU affiliated, so there was no way we were not using Netter. It was blasphemy if we went to Gray's Anatomy. He was a surgeon, and then he just realized the skill and the talent, and he just became an illustrator. And he actually spanned not just anatomy textbooks in medical schools, but he went into pharmaceutical companies and other things, and drew for some other fields. He did like to bring the art into medicine. So, for example, this is one of his early drawings. Before, Grays and Sobotta and whatnot, they just drew a body. He actually put the human touch to it, and I mean that really creates a strong feeling here, vice-like grip. I get it, some crushing. That's what chest pain could feel like. So he became very famous. He is certainly in my world the gold standard in terms of medical illustration. These are some examples of famous artworks of drawing, an older adult in a chair from various. If you can recognize these paintings, kudos to you. When Netter would draw it, it kind of has this artsy feel to it. There's a lot of expression going on here. And actually, he's demonstrating some physical exam findings of accessory muscle use, of venous engorgement, the pursed lips. This person has emphysema. But he clearly has the emotion in it. So it was understandable that it became very popular. All right, last slide here. So when you are trying to decide which book you want to use, Netter, right? Key features here, if you like colorful, artsy, emotions put in it, very clinically oriented, showing a lot of physical exam findings, really good for well, so to speak, visual learner, the all-around go-to textbook. Gray is certainly methodical and systematic, and is, well, certainly a little more purist. So a lot of the scholars tend to use this, but it is a little bit harder to learn, especially in modern times where we have all these other textbooks by comparison. Rohen, of course, is just the picture, straightforward, a realist. And if you're taking, well, not an online course, but an actual in-person cadaver course, this is when we break out the Rohen at the School of Medicine. And then Sobotta, finally, textbook, precise stuff, really great, really clean. And often, if you're in the academia world in Europe, you're probably going to come across that. So hope that helps you decide which textbook to use. I'll see you in the next one.